Dr. Jessica Vallela is the first American-born woman to become a Vaidya and practice independently in India. Based on a unique experience, she strongly promotes Ayurveda as the first line of healthcare in America. Since 2011, Dr. Jessica Vallela has conducted over 24 educational training programs, workshops, cooking demos, and information sessions on Ayurveda. She's a director and instructor of AYU Academy, and she'll be talking on diet and nutrition. Dr. Jessica Vallela.
It is such a pleasure to be here. Thanks, everyone, for organizing this. Okay, there we go. So it's really a pleasure to see all of the Ayurvedic doctors in the US gather like this. I think this is such an important event, and I'm really appreciative to be here with everyone. So like was mentioned, I currently teach at IU Academy. I'm the founder and primary instructor. I've been working for the last 5 years on restructuring Ayurvedic education outside of India to make it accessible and true to its original content as we learn it in India. I myself am not from India, but I'm from Boston, Mass, and was in India for about 8 years, had the opportunity to learn, become an Ayurvedic doctor, and practice in hospitals and clinics throughout South India. So my experience with Ayurveda is a little different than most Westerners. So today I want to talk a little bit about diet and nutrition, and I know we've only got a couple minutes, so I'll try to make this quick and as useful as possible. Basically, whether it be a pandemic or any period of life that we're going through, we want to use food and fluids to the best extent possible to encourage and maintain normal homeostasis. This promotes normal physiology of the body, nourishes healthy growth of the tissues, and retards unhealthy growth. The perspective of how we view this from Ayurveda is quite different from Western medicine. In Ayurveda, we have concepts such as doshas, dhatus, malas, agnis, ama, srotas, and so much more that help us understand how to connect the biorhythms and the effects of the human body in its daily, seasonal, and lifetime presentations. When this deviates from its normal state, we then understand that some type of disease is either imminent or already in process. And using diet and nutrition to support disease management as well as maintain health is one of the mainstays of Ayurvedic practice. So one of the best ways that you can ask yourself if your diet and nutrition is correct for you is to ask how your digestion is working. How do we do this? Well, it's not magic. Ayurveda is a science, and we have mechanisms and ways to measure inputs, outputs, and conversions. We can look at this as a type of equation in a way, so that when we bring inputs into the body converts them metabolically and transforms them and assimilates them into bodily tissues, products, and then separates all that from the waste products. We know that we should get certain kinds of outputs in certain ways. So by understanding what to look for and how to assess it, we can infer the state of the digestive system in any given body. Diet and nutrition also has to consider many of the contextual factors that influence processing of food and fluids. These include things like the physical environment that the person is living in, the season, the time, as in the time of day, as well as the time of life, and very importantly, their mental state. We know that emotional states have a big impact on how food gets processed. Anyone in a severe state of grief, sadness, or anxiety, depression, or any of those things who tries to eat often finds that the food doesn't get digested exactly properly. So what is the emotional state doing to interfere with that? When looking at food and fluids, the most important factor is quantity. This is clearly spelled out in classical literature by almost every author. Quantity is the number one important factor to consider. Second is timing. Then finally, we would look at how the food or fluid is prepared, meaning what is its state? Is it cooked or is it raw? What temperature is it in? What kinds of combinations are we creating and what spices are we using? Looking for unhealthy indicators that lead to disease would be any kinds of signs and symptoms that people probably experience more often than not. And so trying to discern whether that is part of a normal presentation or abnormal presentation is one of the specialties of Ayurveda. So just to wrap it up, some practical tips. How do we actually apply this? There are a lot of formulas, there are a lot of calculations that we can use to figure out what is the best, and it can get quite complex, but if you don't have 5.5 years to study to become an Ayurvedic doctor, the simplest thing is to keep your diet as simple as possible. Make sure the quantity is not excessive. Make sure you're eating your meals on time, at the proper time every day, regularly. Make sure that the combinations are not interacting or interfering with each other, and make sure that the food is prepared properly. To do the most simple type of digestion reset, fast or reduce your input as much as possible. Use freshly boiled hot water and low sodium or no sodium, as well as no spice, for a couple of days to help relieve whatever's in the gastrointestinal tract. Soups and liquidy types of foods and preparations are the easiest as well to help keep things moving smoothly in the system. So I hope that is helpful for everybody. It's kind of the quick and dirty way to think about food, diet, and nutrition, and this is helpful regardless of the time of the year or the state of pandemics or not.
Thank you very much, Dr. Jessica, for a very, very insightful presentation of you. And I'd like to thank all our presenters today for our second half of our event.